There's been another surge in COVID-19 cases. The National Institute for Communicable Diseases says 19,842 new cases were reported in the latest 24-hour cycle. That's an increase of over 6,000 from the day before. Another 36 COVID-19 related deaths have also been reported, taking total fatalities since the start of the pandemic to 90,038. Active cases have risen to over 113,000. All right, now let's discuss these and other COVID-19 related matters. We're joined via Zoom by a critical care professor at the University of the Witwatersrand, Professor Guy Richards. Professor, thank you so much for your time this afternoon.
A pleasure.
Now, Prof, based on what we know about how highly transmissible Omicron is, would imposing hard lockdown help in reducing the spread of the virus?
No, I don't think it's going to make much difference at this stage. We've locked down hard prior to access to vaccinations. We now have vaccinations available to us, and this really should allow us to open up society to a much greater extent. So it actually is somewhat annoying that people are not actually following that advice. Now, I was listening to the previous speaker who was actually saying that there were these big differences in terms of population groups with regard to taking of the vaccine. And it's just annoying, and it impacts upon society as a whole and impacts on the economy as well. So it actually has, there's no reason to lock down society again, other than avoiding, I would say, mass gatherings. I think that those are a factor, or could be a big factor as well. I would also recommend that people still wear masks in public, and this should be enforced as far as possible. And I am also one that is in favor of vaccine mandates with regard to workplace, etc. We cannot afford to stop work any more than we have already over the last 2 years. And neither can we actually say that we should have travel bans across provincial borders if we're actually complaining about other countries restricting us from a movement to their countries or away from their countries.
Of course, there's various conversations that are happening at various points, in terms of this new variant. We know now that more data is starting to come up from scientists across the country. But in some of the conversations that we're hearing, there are two factors that have been coming up from professionals talking about Omicron. We know that it's highly transmissible, even more than the Delta variant. Another interesting take that somebody had said was that the level of immune escape, so in other words, escaping immunity that was established from previous infections, is also something that this Omicron variant has. So people who have had COVID and are vaccinated can still be reinfected by this variant. So speak to us and maybe perhaps dispel what is not true and some of the things that you are seeing that are really coming out that can help us unpack exactly what Omicron is and also how it can affect us.
So there's no doubt that it is very, very highly transmissible. It is the most transmissible variant that we have at the moment. The transmission, each person that has it will transmit it to approximately 2.6, even up to possibly over 3 people. Now that's extremely high, and it means that you won't ever decrease the numbers being infected until that number goes to less than 1, so that each person that has it will infect less than one other person when they actually have the disease. There's also no doubt that immune evasion is significant, but we really need to categorize that into whether or not you can still catch the infection, or whether it is able to still prevent or previous infection or vaccination is still able to prevent severe disease. And that's really what we've been aiming for throughout, is to have some means of preventing the numbers of people ending up in ICU or ending up critically ill, which is what has overwhelmed the health system in the previous waves, and in particular with Delta. So this one at the moment, and yes, it is early, and we cannot say definitively at this point, but it certainly seems to be the fact that it is less severe in terms of the patients that are contracting it. Now, that may be because we have residual immunity in terms of those who vaccinated, but also that up to 60 to 80% of people in South Africa may well have been exposed to this virus before. And as such, they may well have some of this T-cell immunity that will prevent or protect against severe disease. And that's what we're really aiming at here. Immune evasion should not be something we should be terrified about. We should recognize that, yes, you may still contract the disease, but we want to prevent severe disease.
Now, what we are also seeing is an increase in hospital admissions as it relates to younger people. What could be driving this?
So we have to be also careful about those statistics. Currently, for example, in our hospital, the majority of people being admitted who have COVID actually have been found incidentally to have COVID, because every patient that is admitted to hospital has a COVID test in order that they can be put into a ward where they will not infect other people who don't have COVID. So in fact, many people that are being admitted to hospital for other reasons, ranging from planned operations or ranging from delivering babies to trauma to whatever else, are tested for COVID and are found, in fact, to be incidentally positive. And that's one of the reasons why some of the younger group are now being seen to be positive. We're not seeing a dramatic increase in the number of severe cases amongst young people. And the increase in hospitalization at this stage is not generally into the ICU or into the high care areas. It's more into the general areas where people are incidentally found to be COVID positive.
Now, Prof, let's just look at the numbers as they stand currently. I mean, in the latest 24-hour reporting cycle, we know that there's 19,842 new cases. That's 6,000 more than in the previous day. Now, we know that South Africa was going to be in a fourth wave around December, January time, even before the Omicron variant was discovered. Talk to us about what is happening now. Why are we seeing these numbers increasing? Are we in the fourth wave as a country? What are we seeing? How can we make sense of these numbers?
No, we're definitely in the fourth wave at the moment. We passed the point of putting our heads in the sand and saying we don't have a fourth wave at this stage. We're fully into it. The issue is, as I mentioned, that it is remarkably transmissible. So in fact, you can contract this with very brief periods of time of talking to somebody who is infected or being in contact with somebody who actually is infected. So it's likely to continue to increase dramatically like this until a certain number of people or sufficient number of people have been infected. And then again, we'll start to see the decline gradually occurring as less and less people are susceptible because they have already been infected, already been exposed to the virus.
Now, Prof, just as another point of clarity in terms of those that have been vaccinated and those that have not been vaccinated, I'd like you to take us through just what the risks are. We know that the Omicron, variant, as you've also rightfully said, we haven't seen severe cases, as it were. But what are we looking at in terms of those that have been vaccinated and the risks of them, transmitting the variant or the virus in the same way as someone who is perhaps not vaccinated, etc. And also just, within that answer, perhaps help us unpack just what is then needed to happen. Should we then accelerate the vaccination process? Because we know already conversations around mandatory vaccinations are happening at government level.
So if cases are severe, they are usually or more usually in people who are unvaccinated. So your likelihood of contracting this disease and of having a severe episode are more likely in the unvaccinated. If you are vaccinated, it's possible that you could still have a severe manifestation, but it is far less likely that that would actually occur. But the important point there is that and this is actually data from the previous surges or the previous variants, with Delta, what was clearly shown is that people who are vaccinated but contract the disease will still shed the disease at the same amount, but for a much shorter period of time. So not only are you less likely to contract the disease, but you will also shed for a shorter period of time. But you will still be able to shed the virus and still be infective. So that's something that we have to be aware of.
Prof, thank you so much for your time this afternoon. Really do appreciate it. That's Professor Guy Richards from the University of the Witwatersrand.